will go on in lecture hall number 1, that is from 2:30 to 3:30 in lecture hall number 1, from chess number 1 to 7, from 3:45 to 4:45 in lecture hall number 1, from chess number 29 to 35, from 2:30 to 3:30 in lecture hall number 2, from chess number 8 to 14, and from 3:45 to 4:45 in lecture hall number 2, from chess number 36 to 42, and from 2:30 to 3:30 in lecture hall number 3, from chess number 15 to 21, from 3:45 to 4:45 in lecture hall number 3, from chess number 43 to 49, and from 2:30 to 3:30 in lecture hall number 4, from chess number 22 to 28.
Paper presentation for PhD and faculty will start from 12:45 to 1:45 p.m. Chess number 1 to 7, it is in lecture hall number 1. Chess number 8 to 14, it is in lecture hall number 2. Chess number 15 to 20, it is in lecture hall number 3. And chess number 21 to 25, it is in lecture hall number 4. Paper presentation for undergraduates, it is around 3:45 to 4:45 p.m. Chess number 1 to 8, it will be conducted in lecture hall number 4. Thank you. Provides the factual knowledge required to practice medicine, explaining it in the context of underlying principles, basic science and research evidence, and shows how to apply this knowledge to the management of patients who present with problems rather than specific diseases.
Absolutely. Coincidentally, Charaka Samhita also mentions about Siddhantas, Roga Rogi Pariksha, Nidana Panchakas, Chikitsa Sutras and Pramanas, and shows us the right path to be a Pranabhisara Vaidya. The text is not only an interesting source of ancient medical practices, it is also a source of valuable information on ecological, social and economic conditions in India. So now we will be having the first session for the day, which is Dr. L Mahadevan sir's session on Charaka and Davidson. I would like to request Dr. Srinivas Bannigold sir to come onto the dais and head the event.
L Mahadevan sir will start the session.
Pranams to Swamiji, pranams to Chairperson. The girl was about to introduce me. I told her, people know me, and introduction we should do very carefully. Sir was talking about Vivekananda. I am coming from Kanyakumari, where Vivekananda attained enlightenment. So we talk not only medicine, we talk other Indian philosophical and spiritual matters also. So there was a school, there is a school, a Swami Vivekananda school. The principal is not like our principal, he is more Vada in nature. So he was highly restless and he invited me 100 times to talk about Swami Vivekananda to the children. Then I was in the stage, he came and asked me, are you Dr. L Mahadevan? Then I told, sir, I am Dr. Mahadevan, you have been inviting me. Then again he came and asked, because of Chalagunam of Vayu, again asked me, are you Dr. L Mahadevan? I told, as far as I remember, I am Dr. L Mahadevan. This fellow asked 4 or 5 times, will you talk about Vivekananda? Sir, for that only I am here since 6 months you are inviting me. This fellow went to the stage and told, now Swami Vivekananda will talk about Dr. L Mahadevan. So it is nice that you didn't introduce. The vote of thanks also they delivered very well. So thank you for that. So Charaka meets Davidson. I have been studying Ayurveda since 1986. After studying Ayurveda, I had an experience. I was with a wonderful guru, a great human being, great philosopher. So there was a person who came to him with a chaya. So, he was a great person, great person, and he told Agni Deepanam, Shrodo Shodhanam, Brahmanam is the therapy. So, we did Agni Deepanam with Panchakola Yavagu, Shrodasam Tam Vishodhanam, Shatphala Gradam, Snagabanam, Sukha Virejanam, Trivithilegam Virejanam, then Shavanaprasam as one-time food. This was the protocol. Absolutely correct. I think nobody can contradict with me in this treatment Chikitsa Sutram. Because Agni Deepanam, Shrodo Shodhanam, Snegavardhanam, Brahmanam, Rasayanam is the treatment for Kshaya. You know that. So, Sar was doing it beautifully. One day this fellow fell down. And we took him to allopathic hospital because we are not trained in emergency. In Bangalore, I heard that Ayurvedic doctors work in an integrated way in an allopathic hospital. In Tamil Nadu, it is not possible. I don't know whether it is good or bad, but it is good in a sense because you know how to handle emergency. So, this man was brought to allopathic hospital. They checked the sugar was 620 and he was undergoing ketoacidosis. So, Sar approach was correct. So, then I thought Ayurveda alone is not needed. Then I went to Madras Medical College and bought Davidson. That's how I started reading my modern medicine. Then Harrison, Adams and all these things happened. So, morning 2:30 I get up, study Ayurveda, afternoon Siddha, night modern medicine. This I am doing since 22 years. So, since 25 years I have practiced, I have seen around 7 lakh cases so far. I have written around 13,000 pages and I know the mind of students community. Sometimes I feel very depressed. Most of the Ayurvedic doctors are depressed. Depressed to see the students because somehow they enter into this curriculum and they do not know how to come out of it. So, we have to guide them properly, make them positive. They should know the plans, they should know the practicals, how to diagnose, how to treat. All these things are very important. Saju, next. Where are you? So, I wrote a poem about Tridosha. Look for it, it cannot be seen. Listen for it, it cannot be heard. Reach for it, it slips through the fingers. Above it, there is no knowledge. Below it, there is no ignorance. Seamless and unnamed, it is ever pregnant silence. Next. Formless itself, it holds all forms. Though all concepts point to it, it is beyond all concepts. Approach it, there is no beginning. Follow it, there is no end. And we name it Tridosha. See that? Having this wisdom, you have everything. So, everything is made up of Tridoshas. A guru helps you to understand the whole vision, whole Jagat as the manifestation of Tridoshas. Bharatam, Bhavam, Ragam, Talam. Bhavam is the expression, that is Kapha. Ragam is the emotion, that is Pitta. Talam, lubbed up, atrial fibrillation, ventricular tachycardias, that is Talam, Vayu. Bhavaraga Talam is Vada Pitta Kapha. So, the country itself is the exposition of Vada Pitta Kapha. You call it Ichcha Shakti, Kriya Shakti, Jnana Shakti. Kriya Shakti is Vayu, Ichcha Shakti is Pitta, Jnana Shakti is Kapha. We call Brahma, Vishnu, Shiva, Parvati, Lakshmi, Durga, Durga, Lakshmi, Saraswati. In Tamil they call Pasupati, Pasam. And if you go in a car, the acceleration is Vada, brake is Kapha, clutch is Pitta. In cricket match, test match is Kapha, one day is Pitta, 2020 is Vayu. You see that? It's highly restless. So, with this perspective, the whole Jagat, now you go in a cell, the nucleus is Vada, the protoplasm is Kapha, mitochondria is Pitta. So, are you able to globalize the whole picture show? When you come to the neuropeptides, dopamine is Vada, serotonin is Pitta, GABA, histamines are Kapha. So, this is a very minute perspective where the integration happens. It is not integration, it is only understanding, because one foreigner came to my guru, Dr. B. Vaidyanathan, and he was arguing with him all the time. I don't believe in Tridoshas. Sir took a deep breath and told, there is nothing to believe, only you have to understand. See what a beautiful word it is. You have to understand the science properly. Huh? I thought you were doing something else. Okay. Next slide. So, there are 3 gunas. Saumya Agneyam Jagat. Soma guna, Shukram, testosterone. Agni guna, Stri, estrogen. That is red and white. That is why in Hindu temples, In Tamil Nadu, they paint red and white. Shiva Shakta Yuktau Yadi Bhavati Shakta Prabhavidam. So, Kaphavada Samanam and Pitta Samanam. This Kaphavada combination is very important in Ayurvedic practice today, because Vada there is Tatratya Marudam Grandi, Vada there is Shamana Rasa, Pitta Kashaya Tikta Maduram is there, Kafam Kadudikta Kashayam is there, Vadam Vadavittam Maduram is there, Pitta Kafam Tikta Kashayam is there. For Vada Kafam there is no Rasa, there is only Virya. That is why stroke due to infarction, LV dysfunction, cardiomyopathy, bronchial asthma, all these things we give Virya Pradana Aushadas like Kasturi, Tambulam, Gorochana, Gomutram, Lashunam, where the Ushna Virya plays an important role. The Shidam and Ushnam you should understand properly. Moreover, the Vada Kafam and Kapha Vadam are clinically different. Vada Pittam is different, Pitta Vadam is different. More the students are neonates and infants in Ayurveda. So, adult senior Siddhantam. Mula Siddhantam is very important for everything. Mula Siddhantam and Dravya Guna are very important for successful Kaya practice, because my guru trained me like that. So, this Vada Kafam and Kapha Vadam are different. Vada Pittam is vertigo, Pitta Vadam is peptic ulcer, Pitta Kafam is herpes, Kapha Pittam is eczema, Vada Kafam is LV dysfunction, Kapha Vadam is bronchial asthma, Vada Pittam Vidaryadi, Pitta Vadam Drakshadi, Pitta Kafam Guduchiyadi, Kapha Pittam Negrodadi, Vada Kafam Danananadi, Kapha Vadam Dasamula Gadatrayam Yelaganadi. So, this is how we should differentiate dosha vigalpa. Doshagi vigalpanai vigalpamana vigalpayandi di vigaran. It is sarva vigara vigada bhava bhava pradivishesha abhinirvrittigi bhavanti yedi ityuktaga. In Pramegam and Kushtam, the Kledam, while talking about the Kledam, you see the reference. Swedanam and Grahi. Grahi is different, Stampanam is different. Grahi works on Purisha Vagasrodas. Stampanam works on Rakta Vagasrodas. Ashtajurnam is Grahi. Pushyanagam is Stampanam. Next slide. So, in Guru and Lagu Guna, obesity, metabolic syndrome, diabetes mellitus, myxedema, gout, where the Guru Guna increases. Guru is obesity. Obesity is a very difficult problem. Every person, they do not want to do exercise, they do not want to follow diet, they come to the doctor and ask, sir, I want medicine for obesity. That is how they are asking. I asked one person, you take one glass of oats. Then he asked me for weight reduction. He asked me before food or after food. You see that? So, that much of consciousness is there. Metabolic syndrome. If you see Lord Ganesha is the symbol of central adiposity. But you see, Gajananam Bhudaganadi Sevidam Kapitta Jambu Palasara Bhakshidam. In Nevedyam also there is Vada Pitta Kapha. In Nevedyam, Kabittam and Jambu, their glycemic index is 23 and 27. These two fruits can be taken by type 2 diabetes people and obesity people. So, in Nevedyam, there is Ayurveda. In putting the kolam, there is Ayurveda. In celebrating Pongal, there is Ayurveda. So, everything in the whole Jagat we manifest as Vada Pitta Kapha. If you understand that, then you will be very happy to study this course. You will not study this course as a stress. So, many Ayurvedic students feel depressed and make me depressed also. So, I tell them, don't get depressed. You see the paucity of it, see our Rishi Parampara, Vaidya Vidya Sampradaya Karturbhyo, Vaidya Rishibhyo Mahatbhyo Namo Gurubhyaha. The Vaidya Sampradaya Parampara, Arsham, Rishayogo Idam, it came from Rishis, seers. So, you should know, it is not like modern medicine. Ayurvedam Upasmake. I do not practice, I do upasana of Ayurveda. So, hyperhidrosis, hyperthyroidism, weight loss, insulin, all the hormones are expressions of Dadvagni. Insulin is a Kapha type of hormone, glucagon is a Pitta type of hormone, stomatostatin is a Vada type of hormone. Once you study modern medicine, you will know, after studying Ayurvedic knowledge thoroughly, you will know both the things go hand in hand. Then hyperparathyroidism, next Lagu Guna, next angina pectoris, Sido Gunam, Heart pain comes in cold weather. Raynaud's phenomenon, our Shastra says, Damani Pradichayo Damani Ubalepaha, Shidadvesho Anupasayo. In the cold weather, the pain increases in Raynaud's phenomenon. In Vadadiga Vadaraktam, in Ashtangradhyam, you can see this reference. In influenza, facial palsy, cold weather, Bell's palsy will come. Acute coronary syndrome, chills and rigor. Ushnam, hyperpyrexia, erythema nodosum, hyperuricemia, conjunctivitis. Conjunctivitis, the word abhishanti is very important. What is amam for Kaya Chikitsa people? That is abhishanti for Rasasastra. This abhishanti for Shalakya people. Abhishanti is Ushna Snigdam. In amam it is Shida Snigdam. Ushna Snigdam is Vasanta Rudu. Shida Snigdam is Hemanta Rudu. Masham is Ushna Snigdam. Kshiram is Shida Snigdam. This differentiation you should understand. Vadam is Shidam, Kafam is Shidam. Vadam is Apadarpana Shidam, which is degenerative in nature. So neurodegenerative disorders. People with great hope come to us. Cerebellar ataxia, Parkinson's disease, Alzheimer's disease, Lewy bodies, all these neurodegenerative diseases come to Ayurveda with a hope. These neurodegenerative diseases are Vada Kafaja in nature. Koshtam also in Krura Koshtam, Arunadatta says, Vada Pittabhyam, Pitta Kafabhyam, Sannibadabhyam Mridugu, Bahuvada Sleshmabhyam Kruraha. It is not Vada, it is Bahuvada Sleshmabhyam Kruraha. Next slide. Snigdam. Snigdam is a very important kunam. Everything is Snigda except Asti, except Vada. Pittam is Snegam, Kafam is Snegam, Rasam is Snegam, Raktam is Snegam, Vamsam is Snegam, Purisham is Snegam, Ojas is Snegam. Even if you write a love letter, you should write Snegamulla Kavidavukki. You cannot write Rukshamulla Kavidavukki. It will be a failure. You understand? So Snegam, Sneh Alingane idi Snekaga. So Snegam is very important. That is why Susruta said, Snegasaroyam Purushaga, Pranasya Snega Bhuishta, Snega Sadhyasya Bhavanti. So this Snega Guna is very important. Snigdam, that is why Snegavanam, oil massage, all these things, because Vadam is Ruksha and active. The treatment is rest and massage. That's how it became. Dynamism, Vada means dynamism. Vada does not have a form. Brahma, Vada is Brahma. Brahma, there is no form, there is no temples for Brahma. Pitta is Shiva, Agni Tattvam. Pitta, Piraisudi, Pemmane, Pulittole Arakkasaiti. In Tamil Nadu, Tirunavakar sir made a song, a poem, composed. It is called, he is a good fellow. Atherosclerosis, fatty liver, steatoria, pancreatitis. In Ruksham, you have Jogaran syndrome. Coffee and Bakoda. See that? Snigdam and Viruddham. By love he is bringing. Somebody told him, Mahadevan will take Pakoda in the class. See? What a wrong information. Give me water. Memory loss. Vadapradhana memory. We have three. The frontal lobe, prefrontal lobe is very important. The frontal lobe dementia, Pick's disease, you see, miserably they suffer with dementia and behavioral changes. The frontal lobe is Vada, temporoparietal is Kapha, occipital is Pitta. You should know that. In Dara Andal, we get alpha wave coherence in EEG. So I work with the neurologists. We have all, that is Bhagavan's grace. We have got all super speciality doctors. This is the only center where a DM and an Ayurvedic doctor, without quarrel, they are able to practice, because constipation, the Vada people will have constipation of thought and diarrhea of words. The word output per Vada is more. The Vada people will talk 70 words per minute. Pitta will talk 60 per minute. Kapha will talk 20 to 10 per minute. Hello, how are you? So we know that they are Kapha. Before they finish, you can go take bath and come. So that much slow they are. When we tell joke also, after 5 minutes you get somebody laughing. That is Kapha response. The Kapha response is a slow response. Mandam. Osteoarthritis and osteoporosis. If there is no low backache and osteoarthritis, many Ayurvedic doctors will suffer for food. Because most of the colleges only osteoarthritis, lumbar spondylosis, cervical spondylosis, psoriasis, old cervical, old stroke spasticity, nowadays autism, and these types of old eczema, these type of cases only they are seeing. Very NASH cirrhosis, pulmonary artery hypertension, sleep apnea, and they are not exposed. It's very unfortunate. Even in Trivandrum also same type of cases. People themselves select, I think. This is a case, we should go to Ayurveda. This is a case, we should not go to Ayurveda. Like that, people have started thinking. We have to change that. And Ayurveda has become very costly. That's why I have made 30 medicines which are cost effective. Within 100 rupees, we should be able to buy. Very costly. Where will they go and buy these medicines? 200,000 rupees, 2,000, 3,000 rupees if you write a prescription. If you are any system which cannot treat poor will suffer. That is the only problem we are having. We depend on these companies. Every Ayurvedic doctor should learn how to make medicine. Without knowing how to make medicine, you should not become a doctor. If you do not know the plants, it is waste. Many people have not seen plant. One fellow went to Dravya Guna practicals. In the college, he saw some plants near the latrine, toilet. The examiner came from Udupi or somewhere, very Dravya Guna master. He took the plant and kept in the table. This fellow entrance, he came into the oral. The oral, they test the ignorance, they don't test the knowledge. So this man told this plant, what is this plant? This fellow has seen near the toilet. So he was a courageous boy, near the Mutraparai. Mutraparai means bathroom. So he told Mutrapareshye Sideshye. It is near the Mutraparai on the side. What is a family? The examiner was shocked because every day name is changing, new plants are coming. He was also confused. What is the family? Then he told Mutreshye. Okay, you pass, you are passed. See, entrance, I go as examiner to various universities. I asked one person, what is the main ingredient of Shavanaprasam? He told Shavana. I was shocked. The first chest pain I got there only. Shavana, I asked whether how will you add with so many seats are there. One exam I went, I was asking what is Amam? No answer. What is Prakriti? No answer. What is Vikriti? No answer. Then I asked, who is the father of nation? He told Rahul Gandhi. Then the examiner internally is telling, sir, you give him pass mark, sir. How can I give pass mark? 50% is the correct, sir. He told Gandhi. So that type of things we are going. We should be very serious, my dear doctors. Next slide. Delayed milestone. How many autism cases we are seeing? I don't know whether I developed my skill to diagnose autism or when I was a young doctor, I did not see cases. Many cases, counseling the parents. At last you feel very tired at the end of the day, and you show your tiredness to the wife by shouting at her. So you should have balance. Delayed milestone, mental retardation, all mandaguna, cognition deficit disorder, AV block, LV dysfunction, hypothyroidism. Autoimmune disorders, Dadu Agni, the dog biting you instead of biting the thief. Dadu Pagam, Dadu Vriddhi, Dadu Kshayam, Dadu Dushti, Dadu Pagam, Dadu Shaidilyam, Dadu Asamagatvam, Dadu Astiratvam. 7 Dadu Dushtis are mentioned in Brihatrayis. 7 Dadu Dushtis. Everything is beautifully told. Dadunam cha Shaidilyat in Pramegam Pandu. Disintegration of muscle protein. All the vegetables are new age vegetable. Beetroot, carrot, tomato. You are telling Patya, who thought about Rasaguna Viri Vibhaga of these herbs, these plants? The plants that are eaten by Charaka Samhita is not available now. Pindalu, Kadambari, Jagalam, who is eating all these things? So you should teach the current food. Demyelination, burns, ulcers, they are Tikshna Guna. Next. Shidam, Vadam is Ruksha Shidam, Kafam is sickness Shidam. Vadam is Avadarpanam, Kafam is Sandarpanam. Vadam is Varsha Rudu, Vidaryadi. Kafam is Nimbadi. Next. Chalam and Saram. Chalam is mind. The respiratory rate of monkey is 32 per minute. The respiratory rate of human being is 16 per minute. The respiratory rate of elephant is 8 per minute. The respiratory rate of tortoise is 4 per minute. Tortoise lives for 300 years. Slower the respiratory rate, calmer the person you are. That is what Rasapradipika says, Adayoga Pradipika. Chale vade, chale chitte, nischale, nischalam bhavet. Asamsayam ki mahabhago mano durnigraham chalam. The word chala, everybody is using. Chala is the quality of mano gunam of vayu. Tatara ruksha lagu shida. Kara sukshma salanilaga. Karam is a rough fellow. Sukshmam is not magnanimous. Chalam is changeable, irritable, unreliable. Understand that? So saram, adisaram, going out of this seminar. See, many people are going, they are not bothered about who fellow is Panchabhuta Shariram is standing here and talking. They are going, coming and like that. That is saram. That is pitta vada. Once you think about your house or somebody else, that is chala. That is related to mind. Next. Lagu. See, I am going to tell you a beautiful thing. You see, Dadi is snigdha. Grida, which is snigdha. Antidote of Dadi, Grida is takra, which is derived from Dadi. From Tilam, you take Taila. The opposite of Taila is Pinyaga. So, Pinyaga is the antidote for Taila, Takram is given in Snega Vyabhat. So, this is a very beautiful concept in which how two gunas exist together without antagonizing each other. See that? See the Ojas is Shidam and Tejas both. That is why in Hemanta Rudu, Shida Snigdam Agneyam is told. Gridam is Shida Snigdam, but Agni Vardhanam. It is Shidam, but Agni Vardhanam. Snehameva Param Vidyad, Durbala Anala Deebanam, Vyadi Muktasya Mandagno, Sarpirevadu Deebanam. Say beautiful. Now our concepts, it is not only concept, you should see somebody applying it. Next. Snigdha, Ushna Snigdha, Shida Snigdha. Ushna Snigdha is woman, estrogen. Shida Snigdha is men. You understand that? So that is why in marriage, Magadi Garbhavakrandi, Masham, Ulunda Vada is given to woman for pregnancy. Luckily they did not give Ulunda Vada to me. Shidam, milk is given to men by woman because milk is Shida Snigdam. So in the first day of the marriage, milk is given. The man has studied Rasasastra. You cannot give Taile, Takre, Gava, Mutre, Aranale, Kulattaje. You cannot give. Only Kshiram is indicated by Acharyas. You see, that is the beauty of the science. Next slide. Next. Deevanam and Pajanam. Deevanam can be Snigdam, Gridam. Pajanam is Ruksham, Dravyam. Deevanam can be Adravyam, Upavasam. Pajanam, Amapajanam. Next. Still we have not entered into Davidson. Next. 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 Metabolic. Vada is from there it starts. Vada is ectomorph, Pitta, mesomorph, endomorph. Catabolic, transformational, anabolic. Sympathetic, sympathetic, parasympathetic coactivation, parasympathetic. Next. All the Vegas denotes autonomic nervous system. Vada is catalyst, Pitta is tissue acid, Kapha alkaline, neuropeptide, acetylcholine, serotonin, GABA. Psychological, enthusiastic, Pitta aggressive, Kapha calm. Physic, lean and thin, Pitta muscular, medium, Kapha stout. Next. Vada tachycardias, Pitta high volume pulse, Kapha bradycardia. Vada Pitta hyperthyroidism, Vada Kapha hypothyroidism. Vada spastic colon, Pitta ulcerative colitis, Crohn's disease, Kapha celiac disease, gluten enteropathy. Vada abdominal colic, Pitta GERD, Kapha functional dyspepsia. So like this whole system, you can see Charagami Davidson, my book, you can see whole chapters interpreted with the modern sense without losing any integrity and basics of Ayurveda. Next. So this is whole thing goes related to all the system. Next. Next. Non-rapid movement sleeps, Saraswati, Durga, Lakshmi, generation, operation, destruction. Next. Dosha pratyena, Vyadhi pratyaniga chikitsa. Next. For Vada, Thailam, already this I explained to you. Next. Rasayanam. For dental, Thila Rasayanam, hair, Narasimha Rasayanam. Narasimha Rasayanam, they say hair will grow, male sexual function will increase. What does that mean? It works on male testosterone hormone gonads. By increasing the male sexual hormone, hair growth is increased. So, Narasimha Rasayanam should not be given to a woman. That type of commentaries you can see in the book. Next. So, Vadanubandham Rakta Prasadanam. Rakta Prasadanam should be there. Rakta Prasadanam, Manjishtadi is Rakta Prasadanam, but Manjishtadi is not Vadanubandham Rakta Prasadanam. But Pindadailam, Balaguduchadi, Madhushtiyadi, Kajita Pindadailam are Vadanubandham Rakta Prasadanam. Pittanubandham Rakta Prasadanam SLE Amridadi Dailam. Pitta Kafanubandham Rakta Prasadanam discoid Rupa Seritomatosis Amridadi Dailam. Next. So, Kapha Pittanubandham Rakta Prasadanam, diabetic carbuncle, Nisho Ushiradi Kashayam, Yeladi Kalkam, which is called Nisho Ushiradi Tailam, told in Pramega Pitaka Chikissa in Sakasarayam. Next. Vada Pittakaram, Kshirabala. Vada Pittakaram, body, Pindadailam. Next. Vada Kafagaram, Nalpam, Pitta Kafagaram, Nalpamaradi. Kafa Pittakaram, Nisho Shiradi. Next. Vada Kafagaram, Durdura Batradi, Kafa Vadagaram, Yeladi. Next. Hair fall, Vada Pradhanya hair disease, hair fall, Madhuveshtiyadi. Premature hair, Pittam, Bringamalagadi. Lack of volume of hair, Kafajam, Trifaladi. Next. Headache, you take simple headache, you see how many modern, here only the Charaka and Davidson reading both helped me. Vadajam, tension headache, Asana Vilvadi. Pittam, vascular headache, Asana Manjishtadi. Kafajam, sinus headache, Asana Yeladi. Vada Pittam, temporal arthritis, Kshirabala. Kafavadam, normal pressure hydrocephalus, Jalasirshakam. We put Vibhuti here, Vibhuti here, Vibhuti here. We will not put Vibhuti in the suprapatellar bursa or in the leg. Wherever there is Kapha Utklesha, there only Vibhuti is applied in Hindu tradition. Why they did not apply Vibhuti here or here? Wherever in Kaphasthana only Vibhuti is applied. So, everywhere there is Ayurveda, there is Shastra, there is, our tradition is very holy. You should remember that. In Ajna Chakra, we put the Tilakam. What? In Ajna Chakra, we put the Dara. In Ajna Chakra, we keep the Prasada. Two Buddhis. Ishvara Arpana Buddhi, Ishvara Prasada Buddhi is needed for Ayurvedic practice. Whatever is you are getting, you give it to Ishvara, Ishvara Arpana Buddhi. Whatever you receive from the Gurus, Ishvara Prasada Buddhi. So, Vada Kafajam, Kafa Vadajam, NPH, Panjamala Thailam plus Vibhuti. Vada Kafam, intracranial tension, Nirgundiyadi. Pitta Kafam, Vaginous granulomatosis, Amridadi. Pitta Vadam, small vessel vasculitis, Madhuveshtiyadi. Kapha Pittam, folliculitis, Arimedadi. Simple headache, it is like calculation. Diagnosis is equal to Moola Siddhanta plus common sense. Common sense is the problem. That's the problem. That is called Yukti. Yuktistu Yojana. Yuktistrikala Samjnaya. The Yukti, analytical intelligence. Everything is there in the Shastra. Next. Primary idiopathic thrombocytopenic purpura. One fellow told me. I told Vidakta Pittam in Rasadadu, Tikta Rasam, Vasa Guduchyadi, Ruksha Gunam, Kadurogini, Ruksha Virejanam, Trivritilagyam. Diagnosis is over, Samprapti is over, Chikisa is over in 1 minute. But 1 year they had to take the medicine to increase the low platelets. It's a big problem. Immune thrombocytopenic purpura is a big problem. They depend on steroids. Autoimmunity. If you do not know anything, now we call autoimmunity. They call it idiopathic, idi of the padi. Sometimes the woman come with pain here and there. In village, I am practicing in village, you know. So they come with idiopathic causes. I tell idiopathy. Husband would have beaten them. In cities, it is opposite. Cities, I understand it is opposite. One fellow, yesterday I met one doctor, he told me, sir, here it is opposite. Probably you would have got ID from his wife. He didn't tell it openly, but I saw some injuries in the body. So, Vada Samanam Triphala is Chachushyam. This is Charaga. Vada Samanam Chachushyam, macular degeneration, Vibhidagi, Pitta Samanam Chachushyam, Amalaki, diabetic retinopathy, Kapha Samanam Chachushyam, Kadukkai, Haridagi, glaucoma. This is Harrison. When both meets there, Charaga becomes Harrison, you will achieve. So, whole thing, Charaga 50 ganas, Chachushyam, Hridyam, Kandugnam, Kantyam, all I made Vadasamanam Kantyam, Pittasamanam Kantyam, Kavasamanam Kantyam. I divided the 10 drugs into Vadasamanam, Pittasamanam, Kavasamanam. You see, treatment is very simple. Ayurvedam is very simple. It is the lecturers and professors who complicated it. I tell you, including me. You complicated it. It is very simple. It is like Saptaswara. You need Manodharmam, imagination. Without nowadays, students read notes. One fellow written BAMS normal. What is BAMS? Bowel, appetite, micturition, sleep. This fellow invented. So his buddhi is not given intelligence, it is going in another direction. He by heart. He by hearts everything. If he is unable to by heart, he suffers. So this has to be tactually with the Shantas we have to teach. The Shantas we have forgotten. Monotonously we ask them to by heart. How will he by heart? One line of the exam you will tell one line, after the exam you will forget. That is why the writing notes, by hearting, you should have Parayanam in this institution. Every day morning all of us should get up by 4 o'clock and do Ashtanga Hridayam Parayanam. In my Gurukulam we are doing Charaka Parayanam, Ashtanga Hridayam Parayanam, Susrudam Parayanam. During Parayanam they sleep. You give some coffee, that's okay. Next day they will not sleep. So Parayanam is also important. Next slide. Penasam, next slide. Like this I have interpreted. Next. Saju Otuppa, Rasadhaduguva. We will come to this later. Avarana Vada Mandal will be heavy for them. Okay. Vadam is very positive in Pragridavastha and negative in Vigridavastha. Next. Pittam in positive avastha is knowledgeable. Pitta in Vigridavastha in Rasadhadu is critical. Next. Kapham peaceful. Kapham negative in Rasam will become possessive. Kapham positive in Prakritam in Rasam is loving. Negative it will become greedy. So next. So Mano, now here only the Charaka meets Davidson starts actually. I have quitted some 100 slides. When Vada is increased in Rasa, you get angina. When Vada is increased in Rakta, you get hypertension. You don't have to name it. You don't have to name it. Systolic is Vada Pitta, diastolic is Vata Kapha. You give Sarpagandha. From where Sarpagandha is told? Sarpagandha is told in Dandi Haridagi. Sarpagandha is told as a Vishagra Dravya in Susurdam Uttaram. We do not know whether Susurdha Uttaram is written by Susurdha. That doesn't matter. Sarpagandha Ravalfiya, whether you are getting Ravalfiya or Ishwaramuli, that is also not known. So, Vadam in Mamsam produce fibromyalgia, Vadam in Medas produce weight loss, Vadam in Asti produce osteoporosis, Vadam in Majja produce seizures, Vadam in Shukra produce premature ejaculation. You see this? Next slide. Now Pitta. Next slide. Kapha. Kapham in Rasa, metabolic syndrome. Kapham in Rakta, nutritional anemia. Pandu, the Susruta Pandu and Charaka Pandu are different. Susruta Pandu is Rasa Pandu, Charaka Pandu is Rakta Pandu, Susruta Pandu is nutritional Pandu, Charaka Pandu is hemolytic anemia. Charaka says Pitta Pradhane Dosheshu, but Susruta doesn't say like that. Susruta says Vyayamam Amalam Lamanadi Madhyam Vidam Divasopram Adiva Tishnam Nisheva Manasya Pradusha Raktam Dosha Tvacham. Tvacham means Rasa, Rasa Pandu. Rasapandu, Vadapandu, leukemia, Pittapandu, hemolytic anemia, Kaphapandu, nutritional anemia. Vadapandu, Dadimadikradam, Drakshadi legium, Pittapandu, Vasaguduchadi, Kaphapandu, Punarnavadi, Gomutra Haridi. You see this? Very enjoyable. If you sit with me for OP for 1 month, you will get addicted to Ayurveda. I tell you, you will get addicted. You will not leave this. Any joy in the world, 100% more you will understand Tridoshik joy. True. And it gets to you free of cost. You don't have to pay anything. Next one. Now I am coming to the second level of Sarga and Davidson. The Ruksha Gunam of Vada in Rasa, lichen planus. Lagu Gunam of Vada in Rasa, labyrinth and vertigo. The Shida Gunam of Vada in Rasa, Raynaud's phenomenon. Kara Gunam of Vada in Rasa, interstitial lung disease. Sukshma Gunam of Vada in Rasa, pervasive developmental anomaly. Chala Gunam of Vada in Rasa, bipolar. That is why Nagabedam Charaga starts. He comes and comes and comes and comes. And last word is Anavasthita Chittatvam, borderline personality disorder. Anavasthita Chittatvam is Chedanam, Nagavedam is Achedanam. See that? All first year students mostly. So you should understand my suffering also. Next. The snegam of Pitta in Rasam, fever of infective origin. All neonatal kids just entered into the lactation of Ayurveda. So we have to, they should not be afraid by hearing all these words. Don't worry, my dear children, you will also learn all these things. I was like you, worse than you when I was a student. One fellow I asked, where is Tridosha? He searched here and there. But he was sincere. Then I told, you come with me. One fellow put his hand in pocket. I asked, where is Tridosha? Then he found some phone, something. He was searching Tridoshas. You should search everything inside. One fellow came to me and told me there is severe itching in kidney. How can there be itching in kidney? So total understanding is wrong. First I have to teach him where is kidney, then what is itching. Isn't it? So you should be very careful. The Ushnam of Pitta is gastritis. The Lagu of Pitta is hyperthyroidism. Visram of Pitta in Rasa is pyoderma gangrionosum. Whole thing it is calculation. So first is general guna, then individual guna, then each guna, the snegam in Pitta, adipravarti, apravarti, sangam. All my students do this within seconds like playing chess. You come to my clinic and see in my Gurukulam, capacity is 15, we have 19 students. We give food accommodation and stipend. Now we are running a course for 2 years in online. 2 years I am talking free of cost. You join. No fees. It's free. 10,000 students are, 15,000 students are studying. You talk to Saju. Saju will give you how to join the course. Clinical medicine, Guna Siddhanta. 2 years course, free. So you can hear whenever you have quarrel with your wife, whenever you want to sleep or you in the car, you put my tape. At least you will get sleep. Isn't it? Ayurvedam, when I go in the train, everybody will, thief will come, they will tell. I will take one Tarkasankara book and keep it over the bag. Then I will tell, no thief will come. Kunta Munda Lakshanam, Rasasasana, nobody will come. Nobody will come. They are afraid. So gastritis, next. Next, Saju. Saju, enga pone? Guru Gunam of Kapha in Rasa, obesity. Manda Gunam of Kapha in Rasa, dyspepsia. Next. So Ruksham, like Rasam is over. Now Raktam. Ruksham of Vada in Raktam, coagulation. Vada Pitta Vadam in Raktam is bleeding. Kapha Pittam in Raktam is clotting. See how beautifully it is told. Madhura Rasa Pradhanya Chikissa. Kadu Rasa Pradhanya Chikissa. Yashti Madhu Marijam. Marijam, Kadu Rasam, Kadu Vibhagam, Ushnaviryam, Tishna Gunam, Dosha Sangada Vicheda Janagam Pramadi. Removes consolidation, platelet aggregation, aspirin-like property. Inhibitors. Amazing. I can talk and talk and talk, but others also should talk, There are other speakers. Next. Snegam, allergic vasculitis. Pittam, Tikshnam of Rakta, autoimmune. Ushnam, gout. Till there is a controversy in South India and North India between Vadaraktam and Amavadam. Still it is going on since 200 years. Still we are unable to solve it. If you go to North India, we should consider Vadaraktam rheumatoid as Amavadam. If you come to Trivandrum, you should consider rheumatoid as Vadaraktam. So we should not torture the students, because what it is taught, they answer in that way only. Next one. Next. Like this, it is go on. It's one day you cannot lean. No, it's my 25 years of tapas. But if you hear the classes again and again, within 3 months, you all become Gunavaidya. Next. Either you will become mental or you will become a genius. But both are enjoyable. Next. 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 Going on, it is coming. Next. So, Ruksham of Vada in Asti, calcaneal spur. Lagu of Vada in Asti, osteopenia. Karam of Vada in Asti, osteoporosis. Sukshmam of Vada in Asti, dental caries. Chalam of Vada in Asti, temporomandibular joint dismobility syndrome, TMJ. Next. Ushna Tikshna of Asti, Pittam, osteomyelitis. Visram of Pittam, bone infection. Dravam of Pittam in Asti, discharge. Saram of Pittam in Asti, inflammation, movements. Next. Snigdam of Kapham in Asti, osteosarcoma. About cancer, every disease, if you read last 10 verses, you can see the treatment of cancer. If you read Jwaram, you can read Hawkins very well. If you read Raktapitta, you can treat bleeding and coagulation disorders very well. If you read Pandu, you can treat leukemias very well. If you read Arsh's last section, you can treat rectal CA very well. If you see Grahani, if you read Grahani, the last and middle last words, you can read small bowel lesions very well. For example, you take Gulmam. In Gulmam, Ashtachurnam, Chardula Churnam, Naracha Churnam, Vaishwanara Churnam, Hinkavajadi Churnam, Lavana Bhaskaram, Shatfala Gridam, Danti Garidagi, Lashuna Kshiravagam, Balladaga Gridam, Agadaksharam. This is the order in which the Gulmam chapter is covered. Simple gas, simple ulcer, non-ulcer dyspepsia, small bowel inflammation, small bowel polyps, small bowel cancer, large bowel gas, large bowel polyps, large bowel cancer, large bowel metastasis. See the order in which Gulmam yogas are unfolded. You are unable to enjoy this. I feel sorry. Either I am not talking well or you are not understanding well. I don't know. So this is a beautiful word. Sarira avayavastu paramanu bedene aparisankhya bhavanti. Adi bahutvad, adi saukshmiyad, adi indriyatvad. Tesham samyoga vibhage paramanunam karanam vayugu karma swabhavasya. Charaga talks about cancer. Karma swabhavasya. Karma is a slow acting virus which has got a longer incubation period. Only Swamiji's blessing can handle it. That is why Deva Vibhasraya Chikitsa. Yesterday somebody asked, Nirdishtam Deva Shabdena, Saragam Shariram, Kadita Purushiyam, first chapter, 53rd sloka. Upadahi Parokhedu Dukka Dukkasraya Prataha. Nishtayaha idam naishtigam. Brahma Nishtayaha idam. Enna pesaradu theriyala chela madri. You are sitting like stone. What can I talk? I don't know. Give water. Next slide. Sukshmam of Vada in Majja. Next. Saju, Otupa. Next. 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 Now I am coming to the double. First itself is tough. After teaching this in our Gurukulam, now I am coming to Vada Pitta in Rasa, vertigo. Pitta Vada in Rasa, gastritis. Pitta Kapha in Rasa, herpes. Kapha Pitta in Rasa, eczema. Vada Kapha in Rasa, TIA, stroke. Kapha Vada in Rasa, asthma. Vada Pitta, Vidaryadi, Yashtimadu. Pitta Vada, Drakshadi, Mridvigam. Pitta Kapha, Guduchyadi, Nimbadi. Kapha Pitta, Aragwadadi, Nekrodadi, Trayandyadi. Vada Kapha, Badradarvadi, Ashtavargam, Dhanananayanadi, Gandharvahastadi, Chiravilvadi. Kapha Vadam, Pippalyadi, Dasamula Gaditrayam, Trigadu, Panchagolam, Shatphalam, Gorojanadi, Kasturyadi, Tambula Patram. With simple drugs you can handle. If you write more than 3 drugs, that means it is commercial. It is commercial. If you do Pichal and Navarakadi, that is unwanted. Nobody comes to you with starvation. Everybody is coming to you with overeating. You see this? One fellow, one guru took food, so many food. Agantam paye, up to mouth, brim of the mouth he took idli. Then Ayurveda Shishya told, Alpe Langanam Patyam, Madhyame Langana Vadanam, Prabhude Shodhanam. You have these 2 fingers, you put the 2 fingers, everything you will vomit, then you will be free. Then Guru smashed at him. He hit at the cheek. Why did you hit me? He asked. If I have space to put 2 fingers for vomiting, I would have taken 2 more idlis. The Guru replied, that is overeating. Night 2 o'clock pizza. Yesterday I stayed in a hotel, I saw the menu card, night 11 to 4, food is available and the choices are given. 11 to 4 is not the time for eating, you know. You have to sleep well. And so I just went for fun, went to that. In restaurant some 20 people are eating. Then how they will get disease only. They will get disease. So the food also you should eat with chedana, consciousness. If you take idli, dosa, you take dosa, I love you, then you should eat. The consciousness, because chintyanam cha adichintanad rasaha sambradushyati. Chinta affect eating. In modern medicine it is not there. Sarvapalli Radhakrishnan went to America. He was eating with hands. They told, sir, you eat with fork. Hand is not hygiene. He told, my hand is better than fork because others cannot use my hand. See that? So that is why Ayam me hasto Bhagavan, Ayam me Bhagavattaraha. Hasta Bhagavan, Ishvara. Amazing. So more than 20 minutes a person cannot hear. I have talked for 1 hour. I think what any questions you have, you can ask. I have given an orientation that integration is needed. Any modern disease you can interpret in Ayurveda. Any Ayurvedic disease you can interpret in modern. 2 conditions where I struggle to interpret is Gulmam and Udavartam. So in my book I have not translated Gulmam and Udavartam. Gulmam is Gulmam, Udavartam is Udavartam. All the things we can come to a near probable correlation, not a direct correlation. Fever is not Jwaram, but fever comes under Jwaram. Pandu is not anemia. Anemia, hypothyroidism, vitiligo, metabolic syndrome, leukemias, all these come under the spectrum or the umbrella of Pandu. This is what it is. If you understand this, it is more enjoyable. So I request you to join the course. I will also come here frequently to see Swamiji, to seek his blessing. So I love the students. Thanks for the hospitality. If you have any question and answer, half an hour I will do answer. They asked me to talk for 2 to 2.5 hours actually. Now I can, as I am a professional speaker, I can see the restlessness in the last rows. So I should know when to stop. That is itself is an art. So I am stopping here. Now chairman will conclude the session. Thank you very much.
Speakers will be coming to the audience and they'll be passing the mics. So please ask your questions one by one. Thank you.
Source of inspiration. So with the knowledge which you have imparted, something solid must come out. So question number 1.
What, sir? What, sir? I am unable to hear audible.
Oh. My name is Dr. Kamal Tauri.
Namaste, sir.
I am an ardent follower of Swamiji.
Namaste, sir.
Right now, with the knowledge which you have spared, with the knowledge you have shared, with the knowledge you have shared,
Okay, sir.
I have two questions.
Okay, sir.
One, sir, what is your capacity utilization, keeping in mind the challenges of the world and peace? He doesn't listen to Mike, na? Sir, can you listen to me now? Hear me.
Voice is there, but it is breaking.
Okay, my question is, with the knowledge you have shared, what is your capacity utilization in the light of challenges of our time, and what are the bottlenecks that your capacity is not fully utilized? Am I clear?
Some extent it is clear, sir. With my capacity and knowledge, what I am able to do, you are asking.
Capacity utilization.
Utilization, I started my practice with 6 patients. Now 150 patients I am seeing. First I gave job to 3, now I have given job to 75. First I was taking care of 1 village, now I am taking care of 15 villages. Hospital, I had 4 rooms, now I have 45 rooms. I was begging for patients, now hospital is booked for next 8 months. That is the achievement. It is very hospital and very difficult to see me easily. I think this is Bhagavan's grace and hard work. Many diseases I am. Namaste.
I want to ask some simple question. Is it
Sir, we had a corona ward, sir. I worked in corona ward for 6 months. During the corona period, I didn't get corona. When everybody, see Bhagavan's Leela, everybody got corona and corona ward not there. I got corona and I was admitted in the ICU. So, Bhagavan allowed me to serve the poor people. Mild, moderate cases, we treated successfully. We reduced the bill. Around 2000 cases I have treated. All the papers are available in net. Published paper, research work, everything is available in the net, you can see. Some death also we have faced, sir. I cannot say 100%. We got mixed results. 80% success rate. In my village also 7 death happened. We couldn't. Morning they came with 85 oxygen saturation. 2:30 it became 56. 5 o'clock he passed away. But we were putting all the efforts. Yavat kantakada prana tavat karyam chikitsitam. We were putting effort, only that much we can see. So, no disease we can say Ayurveda can cure. We can tell it will be cured, it will be managed, it will be incurable based on the state of illness, avastha they are coming to us.
In their peak of career, they suffer injuries and they cut short their career. Allopathy could not do anything. Lot of things, Ayurveda treatments I have seen. Have you ever tried any trauma management to rehabilitate an injured person?
Sir, we have 3 Marma Vaidyas of traditional origin who do not have qualification in our Vaidyasala from my grandfather's time, sir. I do not know the art, I respect it and honor it. They do wonderful work on ligamental injuries which an Ayurvedic doctor cannot do, sir. You come, I will ask them to demonstrate.
Thank you, sir. Because I am also associated with the Kalari Paithu Federation of India.
Because they are not our community people from Kanyakumari district. They do a great work, sir.
Thank you, sir. Thank you. I will definitely visit. We have a
Again, if the patient is willing, if willpower is strong, up to 170 to 110, we can take them out of the tablets. Early diabetes, pre-diabetic stage, we can reverse. Established diabetes with insulin dependency, we can reduce the dosage and prevent the complicity, vasculopathy, impotency and neuropathy. We cannot completely cure because during Charaka's periods also, Yapyam and Asadhyam was there. Charaka didn't say Gambiram, Bagudadustam, Dirgagalam Avastidam. How will you cure? Janma bala pravrittam. How will you cure? Even Charaka was unable to cure. Individual is important to the treatment in Ayurveda. It is not for society except Janapadom Samsam in few areas. Otherwise, the individual person with the problem, with the environment, with the history, we have to focus that. The result is related to that individual. Medicine A is effective for constipation in A. Same Haridagi will not be effective in B. Koshtam Agni variance is there.
Hello sir, I have a question here. So, how do we understand Krimi in autoimmune diseases? So, what is the role of Krimi in that?
In my knowledge, there is no role of Krimi in autoimmune disease. Whether intestinal worms or H. pylori or virus, parasites, bacteria, that pathology is different. Autoimmunity is different. Antibiotics, antimicrobials, antivirals, antihelminthics have no role in autoimmunity. This is Dhatu Pakam, where Rasayanam plays a role. Rasayanam nourishes. Nadi Pariksha is very good, very great. Unfortunately, I do not know that. My grandfather used to tell, basics I tell, but extremely I am unable to tell. That came to me, sir. I don't know how. I got it. Nadi is a great science. My grandfather was an amazing 60% we know according to his skill. I don't claim that I see Nadi. I depend on regular methods for diagnosis. If you know Nadi, that is extra advantage. Pediatric Nadi, infantile Nadi, pregnancy Nadi, they are very, you need tapas for that. Mantra Siddhi, tapas, meditation, calm mind, Guru's grace. It is not textual like this. This is hard work and textual. Anybody can attain this. Nadi is spiritual. This is textual hard work. Nadi means grace. Grace is needed. Okay, finish.
Now, I would like to request our chairperson, Dr. Srinivas Bannigold sir, to address the gathering.
It is a great honor to me to chair the session of Dr. Mahadevan at the beginning. I belong to entirely separate sampradaya, that Dhanvantari sampradaya. I am a Shalya Chikitsaka. But I can't categorize Madhavan as a Atre sampradaya, Dhanvantari sampradaya. He belongs to all sampradaya. He has given us all the students a very good message. He has written a song about the Tridoshas. I think every day we pray Lord Dhanvantari, by praying Dhanvantari Stavana, we should start singing this Tridosha Sangha every day. That becomes more important. We surrender ourselves to all these Tridoshas. Sir, you have referred something like the students are sitting like stone. It is not so, sir. All the students were not sitting like stone. They were stunned by your deliberations. What Dr. Mahadevan has given us, it is only an abstract. If you want to go through the full text of knowledge, you have to practice like Mahadevan. He said he gets up early morning in 2:30, reads all the Samhitas, and he has given advice to all of us that make Samhita Parayana compulsory for all the students. It is most needed. Unless we don't need the original text, it is impossible for us to understand the basic principles of Ayurveda, because Ayurveda science is an individual science. It's a holistic science. That many of the students have been stunned by his deliberations. Very often I say, what is the importance of such seminars, symposia and workshops to the students and faculty members? It's all about the motivation. The people, the student will get motivated. Very often I say, we can count how many seeds are there in an apple, but we can't count how many apples are there in a seed. I don't know, amongst the gathering, by the inspiration talk of Dr. Mahadevan, how many will become junior Madhavans in due course of time. This is what the contribution of this particular Paripoorna Abhijnana 2023. He told Ayurvedic students, scholars, doctors are many times they are depressed. Yes. But what I would like to tell you, don't be disappointed, don't be discouraged, and don't be depressed. Be optimistic. Always inculcate positive attitude. That's most important. Certainly, you will get success in your life like Dr. Madhavan. There's a difference between growth, progress and success. In the hall, whosoever are assembled here, all of us are categorized into these three categories. Some have grown, some have progressed, very few have got success in their career. Growth is, you are seeing 100, 200 patients per day, getting lot of money, earning in what means you don't bother about it. You have grown in earning the money. That is the only your growth. But when this growth is associated with ethics, ethical clinical practice, if you perform, and you will be morally and spiritually practicing your profession, then that shows that you are progressed in your profession. And when your progress is associated with humility, morality and spirituality, you will become successful person. So if you inculcate growth along with ethics, progress along with humility, and then you will succeed, and very few will reach this particular stage like Mahadevan and like Guruji. They will be very successful in their lifespan. He has given a message. In spite of such an authority in the field of Ayurvedic medical profession, he has alarmed us by what are the limitations in our science. There are a lot of myths amongst the public and amongst ourselves that Ayurveda can cure all the diseases. No. The principles of Ayurveda categorizes the diseases into 4 categories. Sadhya, Sukhasadhya, Kashtasadhya and Asadhya. Where the question comes that all the diseases can be cured. He accepted that what are his limitations, that we have to understand. The students, it's most important for you to understand what you can't treat rather than what you can treat. You must understand what are your limitations. For which there is one saying in Kannada, ಮುಟ್ಟಿದ್ದೆಲ್ಲ ಬಂಗಾರವಾಗಬೇಕಾದ್ರೆ ಬಂಗಾರವನ್ನೇ ಮುಟ್ಟಬೇಕು, ಮುಟ್ಟಿದ್ದೆಲ್ಲ ಬಂಗಾರ ಆಗಬೇಕಾದ್ರೆ ಬಂಗಾರವನ್ನೇ ಮುಟ್ಟಬೇಕು, ಬಯಸಿದ್ದೆಲ್ಲ ಸಿಗಬೇಕಾದರೆ ಸಿಗುವುದನ್ನೇ ಬಯಸಬೇಕು. So we should know what are our limitations in our practice. Hence, he accepted our limitations. Then he mentioned whenever, and his talk was full of joy and humorous. That is the way of communicating with others. He was enjoying his lecture and made us to enjoy his lecture. I tell always, whatever the profession you are doing, if you are a student, you enjoy your student period. If you are a teacher, you enjoy your profession. If you are administration, enjoy your administration position. So if you enjoy with your profession, certainly you will become success. That throughout his deliberation, he was communicating with the students with giving examples which were relevant to the present era of generations. So that's most important, and he has communicated well. As I told, it is only the abstract, not the full paper. And if you have to get motivated by his guest lectures, and he has talked about the ahara also. As the Shastra says, Langanam Paramoshadam. In other way, what he was telling that we are, the human beings nowadays, we are becoming eating machines. We are becoming an eating machines. Whatever there is available, in whatever time, we go on eating, in odd hours also. So, Langanam Paramoshadam, that is most important. Many people were asking what are the lifestyle disorders, it can be cured or not. What are the metabolic disorders which are being the challenges for Ayurveda nowadays. Basically, it is because of ahara. Ahara considered as one of the Trivida Stambha. Ahara, Nidra and Brahmacharya, and we are not following any one of this. That's why the whole society is sick now. If you want to come out of that sick, we have to follow strictly the principles of Ayurveda. With these words, I once again feel myself proud to be the chairperson of the session to Dr. Mahadevan. I once again extend my sincere thanks to organizers for giving me this opportunity. I would like to end my remarks by saying that with this, you should become Tat Parivartanam Bhava. Be the change. Thank you, one and all.
Thank you very much, sir. We had a few questions left out from the delegates that our volunteers have collected. I would like to request Mahadevan sir to answer them.
he has delivered the inspirational speech for us. It is not mere speech. Today I feel that I should also get admit in his college as a student. See, most of the students from different colleges are participating here. Very frankly, I am from financial and law background. When I started this college, then I also had one curiosity, inquisitive, you can call it, that I would learn Ayurveda. But my beloved Bhagwan, he has not blessed me with Ayurveda, rather with Marma Chikitsa. So certain things which are incurable diseases, what our Dr. Mahadevan, my son, has told, of course, our forefathers have cured that. And proud to say on this dais, the diabetes and dialysis patient can be reversed. With the support of Ayurveda, Siddha and Marma. Similarly, one more patient, recently he was here, whose ejection fraction was only 31%. And within 1 week, with the support of Ayurveda medications and Marma Chikitsa, his ejection fraction has come to 38%. When he was walking to our hospital, almost he was in a death stage. But today he is in Delhi and he is so happy that he got his life back. So he has the knowledge, the complete knowledge of Ayurveda. You can't see Charaka or Shushruta now. But what they have propounded, he is here in their form. So all you should join in his courses, and what I feel is we will organize the Zoom meeting to conduct the classes every week or fortnight based on his convenience, and all the students should participate, and it will be completely free of cost. And those who want to attend his class and his village, we will organize that and you can go freely.
As per Swamiji's blessings, I will be an obedient Shishya to Swamiji and I will do everything free of cost without charging single paisa to teach, which I have not done so far.
And all the eminent doctors who are present here and all the colleges who have supported and sent the students